Welcome back to Feminist News from Planet Esoterica. I'm Autumn Breon, and if you're tuning into our frequency from planet Earth, we're reporting 300 light years away with critical updates on reproductive freedom. Our broadcast is a mechanism for one of the most important forms of care: accurate information. This is not medical advice and is for educational purposes only. Back to Project 2025. And now they have their sights set on birth control, abortion care access, and sex education. They're currently working through eliminating the HHS, Reproductive Health Care Access Task Force, that part they've done, and installing a pro-life task force. That part is in progress. They're also preventing the VA from covering abortion services. As the nation's largest employer, the federal government is setting the tone, proposing rules that would bar doctors at the Department of Veterans Affairs from performing abortions, even in cases of rape or incest. If the government can restrict care for its own employees, it paves the way for every other employer to do the same. Project 2025 aims to implement a broad anti-sexual and reproductive health and rights agenda across the government, including by changing the mandate of key agencies and rewording policies to stigmatize and delegitimize sexual and reproductive health terms and concepts. While the government was shut down, you can thank MAGA Republicans for that one too. The FDA approved a generic version of the abortion pill mifepristone, which, as people struggle with healthcare costs, will almost definitely lower the cost. It was a rare moment to celebrate, but we have to remain vigilant. They're not going to let up on trying to ban mifepristone. The proposals in Project 2025 would bring back outdated restrictions requiring in-person visits, in telehealth access, and even revoke the FDA's approval of the drug entirely. 2/3 of abortions use mifepristone. Without it, clinics will be overwhelmed, wait times will rise, and people in rural areas will be left without options. Project 2025 argues a president could skip the FDA entirely and use the Comstock Act, an 1873 law about obscenity, to stop mailing abortion medication and supplies. Enforced broadly, it could mean a nationwide abortion ban. I don't know about you, but I'm not looking on the 1800s for modern health policy. It looks like we have a call from Janet in Virginia.
How have people resisted abortion criminalization in the past?
Great question, Janet. You're right. Abortion criminalization isn't new. As long as abortion has been criminalized, people have resisted. One of my favorite stories of resistance is the story of the Jane Collective. Before Roe v. Wade, getting an abortion could be dangerous. As many as 30 patients a day were hospitalized for complications from self-induced abortions, and death rates were highest for poor women and women of color. In 1965, Heather Booth connected her friend with a doctor for an abortion. Word spread, and as more women called her dorm phone asking for help, she told them to ask for Jane when they called. She worked with other organizers to provide abortion referrals for the calls she continued to receive. They called their group the Jane Collective and used underground publications and word of mouth to advertise. Jane Collective members counseled patients on what to expect and held their hands for the entire procedure. They even learned to perform abortions themselves and created a mutual aid fund. The Jane Collective provided care for over 10,000 people. Today, information is still a form of care, and we have a special guest patching in from planet Earth. Over to you, Heather.
When we organize with love at the center, we have changed this world, and we can change this world, and you will change this world. We need you to do that. I'm Heather Booth. I had founded Jane when 3 people talking about an abortion was a conspiracy to commit a felony. That was 1965 in Chicago. As you know, the women of Jane then performed themselves over 11,000 abortions before Roe. But the struggle continues. We need your involvement, because when people care for each other and have a vision of a better society and then do the work every day, we can make it so. Thank you for carrying on that work, that tradition. Thank you for being forces of hope. We need you now.
Thank you, Heather. Folks like Heather Booth's organizing reminds us that harm is not isolated, and it impacts all of us. It's so important to recognize that Republican lawmakers use the same playbook to attack multiple types of care. The same tactics used to ban abortion are used to cut gender-affirming care. The Dobbs decision, which overturned Roe v. Wade, dismantled reproductive rights and simultaneously emboldened efforts to control the bodies of trans people. We've talked about how the Supreme Court's ruling in the Scrimeti case greenlit Tennessee's ban on gender-affirming care for trans youth. Scrimeti leveraged the Dobbs decision as legal precedent to argue for a ban on gender-affirming care. Tennessee Attorney General Jonathan Scrimeti used an abortion ban as justification for denying trans youth access to critical health care, based solely on having a gender that doesn't correspond with their sex assigned at birth. Another anti-abortion lawmaker, Senator Josh Hawley, introduced the Prohibiting Abortion and Transgender Procedures on the Exchanges Act, which is a bill that would prohibit government-regulated health care from offering plans that provide coverage of abortion or gender transition procedures or drugs. This care crisis is truly a crusade to restrict people's control over their bodies, choices, and futures. Now it's time to spot the reproductive roadblocker. It's easy to blame the system as a whole, but it's important to identify some of the individuals driving the anti-abortion movement. Today's reproductive roadblocker is Senator Josh Hawley. Senator Hawley is a Republican senator from the state of Missouri. He's a member of the Senate Pro-Life Caucus, which is a group of senators who vet legislation through an anti-abortion lens and facilitate collaboration with anti-abortion organizations. The senator is coincidentally married to attorney Aaron Hawley, who last year argued against the FDA's approval of mifepristone at the Supreme Court. Let's check Senator Hawley's congressional record on reproductive freedom for all. He's scored 0% every year that he's been a senator. And he's not even listening to his own voters. His own constituents have made it clear that they support abortion. Missouri passed a ballot measure in 2024, the Right to Reproductive Freedom Initiative, adding a fundamental right to reproductive freedom defined to include abortion and all matters relating to reproductive health care to the Missouri Constitution, among other provisions. The Trump administration is putting politics over medicine and care, and Senator Hawley played a key role in the GOP's coordinated attack on mifepristone. Earlier this year, the FDA commissioner stated in his confirmation hearing that he had no preconceived plans to restrict mifepristone unless there was new data to suggest a safety issue. Literally days later, the Ethics and Public Policy Center, or EPPC, which is a known Project 2025 sponsor, published a junk science study filled with anti-abortion lies about mifepristone. Senator Josh Hawley used that junk science study to introduce a bill in Congress, the Restoring Safeguard for Dangerous Abortion Drugs Act, to ban the mailing of mifepristone. After pressure from Senator Josh Hawley and anti-abortion extremists, the Department of Health and Human Services Secretary Robert F. Kennedy Jr. and FDA Commissioner Martin McCary confirmed in a letter to anti-abortion state attorneys general that the FDA is launching a politically motivated review of mifepristone. The vast majority of people in the U.S. support access to medication abortion, and instead of listening to decades of scientifically backed medical evidence, the FDA is being weaponized by Trump and his allies to advance their extreme agenda of banning abortion nationwide.
We'll be right back after this ad break.
Fake health centers, sometimes known as crisis pregnancy centers, CPCs, or anti-abortion centers, AACs, are organizations posing as women's medical clinics, but they are actually unlicensed and unregulated religious nonprofits run by anti-abortion advocates. Here are some tips to help identify fake clinics. Ask directly. Inquire if they provide medical services, such as abortions and contraceptive services, rather than just pregnancy tests and ultrasounds. Legitimate clinics will give straightforward answers. Check credentials. Ensure the staff includes licensed medical professionals like doctors, nurses, or physician assistants. Verify and review. Look for the clinic on official health websites and read reviews on trusted review sites. And then here's what to do if you spot a fake abortion clinic. Leave immediately. Report the clinic. Notify local health departments or health regulatory authorities. Share your experience. You can share your experience online or with reputable organizations like PPACT and National Abortion Federation to help others avoid it. Seek legitimate care. Go to youalwayshaveoptions.com for abortion care or resources. And you can find verified abortion providers at ineedana.com and abortionfunds.org. Today's hero of the week is every abortion provider working across clinics, hotlines, telehealth networks, and community spaces. Abortion providers show up with skill and care in environments that are often stressful and unsafe. They counsel patients who are scared, grieving, relieved, certain, uncertain, and everything in between. They hold space without judgment. They protect privacy. They answer questions with patience. They offer clarity when the world is loud with confusion. Many of them face harassment on their way to work. Some literally have to wear bulletproof vests. Legislators try to criminalize routine medical care, and still, providers continue. They continue because they know that reproductive health care is care, and we all deserve dignity. So to the doctors, nurses, counselors, midwives, doulas, telehealth providers, and care coordinators, thank you, and we see your courage. Thanks for tuning in to Feminist News from Planet Esoterica. It's been a joy to equip you with all of the care and accurate information that you need to make reproductive freedom a reality. Remember to take care, and we will see you next time.